I guess I'm part of a dying breed. I'm still a free market, believe in capitalism Republican, which is apparently rare in this town. I happen to agree wholeheartedly with my associate, Mr. Timmons, that we have dramatically removed all costs in any kind of decision making from patients, all through the regulatory schemes that originated here in Congress. And so we further continue to try to remove any kind of negotiating power. And then we wonder why healthcare costs just continue to skyrocket year after year. And yet we have this one example where healthcare costs are not. And so, but yet it seems, if just from hearing this, what I've heard today, you guys are forcing yourselves on your customers. That you're almost do you literally put a gun to the head of the businesses that hire you, that pay you, Mr. Joyner?
Not at all. In fact, they hire us to do a very specific job, and as we've said earlier, very high satisfaction rates.
And if they're not happy, they have to continue to pay you, right?
Exactly. They have choices and options.
So if they're not happy, if the price is too high, just like in the normal market, they can choose someone else. There's apparently 70 different options, and yet we're here wanting to dig deep into your pricing structure, get involved in your profits. That's what's remarkable to me. Now, look, I do have concerns about my independent retail pharmacies, and I was pleased to hear that you guys are engaging with them. I'm going to get to that question next, but if the product that you're offering is so bad, let me ask this, and I think this would be telling. Big pharma, pharmaceutical companies, they obviously don't like you, right? You guys negotiate down pricing, but do they utilize you, Mr. Kotzner? Pharmaceutical companies have employees. Do they purchase, and this will be very telling, do they use pharmacy benefit managers to manage the insurance costs of their own employees?
Congressman, yes, we do have clients who are pharmaceutical manufacturers.
Why in the world would they choose? Obviously, you're forcing yourself on them. You're forcing yourself for them to purchase your services, right? The services that they say are so egregious, and yet they choose to hire one of you to manage their own employees' costs. I think that's evidence enough, but I want to get to what can we actually do to reduce the costs of pharmaceuticals for patients, and I'm trying to be creative. Think of what can we do to deregulate instead of what this place does is just add more regulations, try to get into the lives and the businesses that as much as possible. What regulations could we look at that would actually empower independent pharmacists and hopefully provide better access to patients? And I would like to hear from each of you.
So, Congressman, I think our track record speaks for itself, which you mentioned earlier. The PBM industry, specifically CVS Caremark, has been very successful in creating competition to lower costs for our customers. And if you look at the generic medication adoption rate, it's 9 out of every 10 prescriptions is a low-cost generic. The remaining 10 that are brands, we use competition to effectively lower the overall cost. So between 2017 and 2022, we were successful in lowering the brand medications by 15%. So I do think that the PBM model does work in terms of creating competition and lowering cost. I will add on that I think what the concern here is the out-of-pocket cost for the members, and in large part that's what we've delivered, introduced a new pricing model called True Cost, because the idea now is to make sure that the member gets exposed to the lowest net cost. That's in fact, what the pricing model is inherently designed to do is make sure that it gets closer to the acquisition cost, making it simple and easy for the patient to access the medication.
So, Congressman, in regard to independent pharmacies, You're from Missouri. I live in Missouri. There are unfortunately 20% of Americans living in rural America today, and only 10% of Americans' physicians live there. That creates an access to care challenge. Independent pharmacies can help fill that challenge by allowing them to work at the top of their license, expanding scope of practice opportunities.
100%
so that
agree.
They have those opportunities and they can get to the patients that need them most. When I was a kid, I used to go to an independent pharmacy because it was hard to get into a doctor at the time. It's that type of work that we need to work together on and partner to be able to do, and that will have a real effect in communities.
So,
Oh, I'm sorry, go ahead and answer the question.
yeah, I'll be very brief given the time. We agree with your points that transparency, choice, and a competitive market serve our customers. They value that choice, as we described, and we continue to drive both affordability initiatives to consumers and support for independent pharmacies.
I really appreciate your comments, and I wholeheartedly agree. I am going to be pursuing an effort to try to reevaluate what pharmacists are allowed to do to try to increase their scope, because at the end of the day, we need more healthcare providers, we need better access to healthcare, and we need to improve their ability to get reimbursed. And I think this may be a win-win. Thank you.